Imagine losing your doctor you've been going to for a decade, or even having to pay hundreds of dollars for visits that your insurance is supposed to pay for you. That's what's happening to many Clark County School District teachers.
Why? Well, their health plan is a nonprofit, and it's not being funded the way it needs to be. News 3's Tiffany Lane has the story.
To simplify the situation, our teachers have one health insurance option, THT Health, that's funded by CCSD. Now, over the last few months, I've spoken with teachers who've lost very important doctors, lost their therapists during a challenging time of the pandemic, and in some cases were sent to collections. For some, their health care is vital. Tonight, we heard from teachers with type 1 diabetes, cancer, and significant health issues that need proper care. But they say because of current issues with their health care, that's not always the case. Some wake up every day wondering if their essential care will be taken away.
And a teacher friend, colleague, she just went to the hospital. She's concerned that once she gets over her pneumonia, then she has to have heart surgery. The out-of-pocket expenses, that's what she's going to incur.
Well, recently I have attempted to get myself a therapist because obviously the issues around teaching through a pandemic and dealing with students who have emotional struggles and academic struggles, that really took a toll on my mental health, and attempting to find a therapist through Teachers Health Trust is nearly impossible. I've been forced to live out of network and pay $90 a session.
Here's how their health insurance works. The teacher's health plan, called THT Health, as I mentioned, is funded by the district. CCA is the bargaining unit that represents teachers. Earlier this year, the two groups came to an agreement that the district would give a $35 million advance toward the deficit. But they say more money is needed.
Actually, it's very little. CCA went up to Carson City in a partnership with the district to fight for funding for our kids. We got $315 million, a record number, from mining taxes that had never contributed since 1865. We also got another $500 million added to the base funding for education that Clark County gets. And not to mention the hundreds of millions of dollars from the federal government this district's sitting on. We need very little, very, very little.
How much money do they need? During the presentation, they said about $9.2 million. As far as CCSD's response to CCA's presentation tonight, here's what the district's chief negotiator had to say.
And so, without going into further details, I can say that the new CEO of THT has worked very closely with the legal office as well as with Mr. Gowdy's office in order to provide us a substantial amount of documentation. We still do not know how $40 million, $45+ million wasn't paid on time, and we still do not understand exactly why the teachers are the ones that have to suffer when it is THT's financial responsibility. And that financial responsibility is a relationship that we do not control as CCSD. That is a relationship between CCEA and THT.
Are you a teacher having issues with the Health Trust? Send me your concerns. You can email me schooltips@news3lv.com or call 702-805-0489.
Golden Knights begin their third COVID-affected season today. This time, they say they have a new weapon. The entire team has all been vaccinated. Now, both the Golden Knights and the Raiders have all had their shots. A CDC panel is weighing in on who actually should get their first booster shots now as we look at the Knights and look at the Raiders, and those who believe in these shots build on the success.
This is America's war on COVID-19. The panel's recommendations go to the head of the Centers for Disease Control, who is expected to green light to recommendations and get those boosters going. Our Jeff Gillen has been looking at that, and he also looks at what the rollout would look like here in the Las Vegas Valley. Jeff?
That's right. Good evening, everybody. As has been reported, those first booster shots will go to people who received 2 doses of Pfizer.
People like Carrie Price, here with her husband Howard. Both got Pfizer. Is she getting a booster?
Yes, in about an hour.
She's not waiting. At 70, Carrie Price doesn't want to take chances.
It just seems, Jeff, like it's not a pleasant way to die. You know?
A CDC panel today green-lighted boosters for people who got Pfizer age 65 and up. It also approved boosters for those 50 to 64 at severe risk of COVID, and by a slimmer margin for those 18 to 49 with underlying health problems. The recommendations now go to the head of the Centers for Disease Control for approval. The booster campaign here will look different than what we saw when vaccines first arrived.
The booster dose that you would get is based off of when you got the previous dose, so you have to wait a certain amount of time after that.
Brian Labus is a health expert at UNLV.
Which means because everybody didn't get vaccinated initially at first, the booster doses will be spread out over months as people get to the point where they're now eligible for it.
According to the CDC, you'll become eligible at least 6 months after you received your second dose. That will cause a staggered booster schedule, which means the rollout will look like what we see now: shots on demand at pharmacies, doctors' offices, and grocery stores. It's doubtful we'll need the big vaccine sites we had earlier in the year, experts say. The Southern Nevada Health District tells me it will provide vaccines based on the Centers for Disease Control guidelines. A spokesperson tells me we have current capacity to provide vaccines to people if eligibility is expanded. In Southern Nevada, the boosters will be another piece of ammo to fight COVID. The county is still struggling to get more people vaccinated. As of today, just over 57% of those eligible in Southern Nevada have completed their shots. So, first boosters will be Pfizer. Federal regulators have not yet authorized boosters for Moderna and J&J. They also have not authorized mixing and matching shots yet. In the meantime, both prices now have their boosters. Howard got his a month ago.
We have a grandson who can't get one yet. He's too young. And it makes us feel like we're helping to protect him.
We've seen it a lot over the last year in many different forums, yelling and screaming, outbursts at public meetings that are really designed for the sharing of thoughts and feelings. So what's causing all of this?
News 3's Lauren Clark spoke to a psychologist who explains how the pandemic has sparked the outrage.
Yeah, well, scenes like this, as you mentioned, have become all too familiar at public meetings across our valley. But a psychologist tells me it's fueled in part by what he calls a frustrated response process. With the uncertainty of the pandemic, people are afraid and vulnerable, causing some to lash out.
I don't answer to you. You answer to us.
Before the pandemic hit, the same kinds of meetings happened about contentious issues, but they didn't often devolve into these kinds of screaming matches.
Screaming matches, hurling of obscenities, and constant disruptions. Some actions even warranting handcuffs or detainment by police. Behavior Clark County Commissioner William McCurdy II has experienced firsthand at his town hall meetings.
People are becoming more and more apprehensive about attending public meetings because of the sheer division and the outbursts that we're seeing.
With some outbursts, even forcing a recess.
It gets so contentious throughout the duration of the meeting that we can't conduct the business.
I think what we're seeing is a combination of personality, emotional, and situational factors all coming together to create this toxic stew.
A toxic stew that UNLV psychology professor Stephen Benning says is boiling over with anger.
Emotions can be more or less contagious.
With issues like vaccines or masks striking personal core beliefs.
We may find it challenging to find common ground if we don't even share fundamental assumptions about how society should work and what we should value.
But finding common ground and staying civil is what Commissioner McCurdy hopes our community can find soon in the future.
We do want the public to continue to show up and have your voice heard.
And Benning also points out another factor in all of this: people only choosing to talk with people or consuming information that feeds into their biases. He says this can make people angrier and cause them to lack empathy or insight for those who might feel differently.
Hi everybody, I'm Reed Cowan from News 3 Las Vegas. We want to thank you for checking out our YouTube channel. Remember, you can always see more of our videos by clicking on the video links. And also don't forget to click that subscribe button so that you don't miss out on any of our YouTube updates. Thanks for watching.